Joined now by Republican Senator John Barrasso of Wyoming, who is a member of the Republican leadership on the Senate side, serves as the Republican Policy Committee chair, also a medical doctor. Senator Barrasso, see, I had a lot of introductory titles for you there, so my apologies.
Thanks, Chuck. No, good to be with you.
Senator, I know you came out yesterday supportive of this plan. You are well aware of where many conservatives, whom you share a lot of views with many of these conservative senators, but not on this issue. What do you say to Rand Paul, who says this plan is dead on arrival in the United States Senate?
Rand has a lot of good ideas. All of these members have a lot of good ideas that we're considering and working through. And Chuck, I will tell you, the reason there's a sense of urgency is Obamacare is collapsing. In my home state of Wyoming, they're basically down to one choice for buying insurance on an exchange, and it continues to go up over 25% the year before, the huge double-digit increases with huge copays, and by next year, there's going to be places all around the country where nobody is selling on the exchange. Obamacare is collapsing. We need to do something. That's the sense of the urgency.
Well, some would argue, Senator, that it's a chicken and egg thing, that if you believe it's collapsing, it's because many insurers hear that you guys are going to repeal and replace it. So let's set that chicken and egg. You guys have made it, you have to do this first. You made it statutorily that you have to deal with this first. So I guess walk me through how you're going to get these factions together at this point, especially since I think you have to do this without a single Democratic vote.
Well, first of all, this was collapsing way before the presidential election. So either whether Hillary Clinton or Donald Trump was elected president, we would be having to do this right now, no matter who won the presidential election, because insurance companies had pulled out. Young people were not buying, and half of the people that were thought to have been ready to sign up by last year, only half of them actually did sign up. So this has been an ongoing problem with Obamacare. So we believe we have a responsibility, and I have a commitment to try to provide affordable health care for the American people, and that's what this is aimed at doing. I think this is a monumental shift away from Obamacare. It's a significant improvement over Obamacare. Is it perfect? No. Are they going to have debate, discussion, amendments? Yeah. Absolutely.
You know, one of the critiques on the right has been this is an Obamacare light. And the argument is this, Senator. I understand there's many parts of it that change, but that the architecture is essentially very similar to Obamacare because, frankly, if you're going to have this mix of a public-private partnership, it's going to be structured, at least, you know, from 30,000 feet, somewhat like this. Do you accept that, what one might say critiques, others might say a compliment, that this is a form of Obamacare light?
To me, this is lights out on Obamacare. The opportunity to actually reform, update, modernize Medicaid, an entitlement program that is dysfunctional, but has been what basically Obamacare has been all about, because over half of the additional people covered under Obamacare got that way by being on Medicaid. This is our opportunity, the first time in 50 years, to do fundamental entitlement reform, and I want to embrace that opportunity and get the job done.
Is the goal of this bill is what? Is the primary goal to lower costs? Is the primary goal more coverage?
It's affordability so that more people can actually get coverage. Many people have been priced out of the market under Obamacare. Even with the subsidies, people weren't signing up because they felt it was a bad deal. So many people that had Obamacare coverage, the copay was so high, they said, I have coverage, but I can't go and actually see a doctor. It was coverage without care. The networks were so narrow. So my goal is to provide access to affordable insurance so they can have affordable care. And then that way you want more people to be able to have it.
You say access to it, but it may come with less dollars to buy it.
Well, if you actually are successful in lowering the cost of care, no one would need as many dollars to buy it. I mean, that's the whole idea behind it.
That's a promise that seemed to be a reach when President Obama made it. And frankly, when has any prediction that somehow the cost of health care is going to go down based on some intervention by the government, when has that prediction ever come true?
That's why I'm trying to get the decisions, Chuck, out of Washington and to the states. Get this out of government control and into patient control, let people at home make the decisions that's best for them. And part of that is letting them buy what works for them and they can afford. You know, under Obamacare, people have had to buy this so-called essential health benefits, which was a huge basket of insurance that for many people, and certainly I hear about it every weekend in Wyoming. I heard about it at a health fair in Buffalo, Wyoming this past weekend. They said, look, it was insurance I didn't want, couldn't afford, didn't need. It was too much. It wasn't right for me. The president said I had to buy it, but it wasn't right for me and my family. And we want to have people have that choice.
Let me close with this. The bill that you pass through the Senate, are you going to be able to promise the American people that it means you can get more insurance for a lower cost?
Well, you can get insurance that's better for you at a lower cost. That's the goal, but we got to see what comes out of the House, comes to the Senate, gets past the Senate, and then is put on President Trump's desk. But I am committed to long-term solutions for affordable care. That's what I want to work on as a doctor as well as a senator.
Senator John Barrasso, member of the leadership on the Senate side from Wyoming. Always a pleasure, sir. Thanks for coming on, sharing your views.
Thanks, Chuck.
You got it.